Thanks for joining us on ECCMID Television. My name is Michael Jackson. It's your pleasure to be your host as we unpack for you a series of interviews with some really special people here at Congress with us. Our next guest is, of course, no exception. It's my pleasure to introduce you to Professor Andrew Ullmann from the University of Würzburg, Julius-Maximilians-University in Germany. That was a long description, sir.
I know.
Does it fit? Is it okay?
I think it's okay, but you could just say University of Würzburg would have done the job as well.
I can also say that you are working on the study group of the fungal study group here with the ESCMID study group as well. That's one of the largest study groups of the 30 or so groups that exist currently.
Correct. Actually, we are one of the largest, I think the top 5 largest study groups here at ESCMID. It's an old study group, but we're expanding every year. We have almost 80 members in our study group, and it's a very active group.
So you're putting the fun in fungal?
Yeah, we're fun guys.
I love that. Fun guys is brilliant. I love it. You see, there we go.
People, yeah.
Now, so why is your group one of the largest groups? Tell me what makes it special.
Well, I think there's an unmet medical need that was not recognized for many years. Fungal diseases is something very unusual. First of all, the normal person would think about athletic foot.
Yeah.
But that's not what we're handling.
Okay.
We're taking care of other diseases, especially chronic pulmonary aspergillosis that affects over 250,000 patients a year in the EU.
Wow.
And up to 20,000 patients with invasive aspergillosis per year in Europe for invasive aspergillosis after cancer treatment, for example, or allogeneic transplantation or organ transplantation, HIV patients, or these typical immune-compromised people that receive a certain kind of treatment, but then all of a sudden suffer an opportunistic infection that could end deadly. So a lot of people are insecure, and the market of new drugs is expanding. There's insecurity about diagnostic procedures, and we're trying to bring light into that area, and I think that's one of the major tasks that the study group has to do here.
When you say the market for new drugs is expanding,
yeah,
beyond antibiotics?
Beyond antibiotics, we call them antifungals.
Yes. Because
they are active against fungal disease. And when I went to medical school, just a couple of years ago, of course.
Of course.
Yeah. That was very easy to ask, how do you tackle invasive fungal disease? It was just amphotericin B, and that's all you needed to know. But in the meantime, we have at least 3 to 4 different drug groups that are available. There are different molecules that are available. There are adjunctive therapies possibilities. There are immune therapy possibilities out there. And when to use it, how to use them, that's the big question. And that's, for example, one of the things that our group is very strong at. We actually published several guidelines the last couple of years. One of the largest guidelines was for yeast infections, for Candida infections that we see in the ICU. You don't have to have cancer. You could be on the ICU after surgery, and then you have invasive candidiasis, which could be also a very devastating disease. And I'm very proud to say that our guidelines that we published for Candida, for example, 3 years ago, was well accepted. We have almost 300 citations of these guidelines, which actually underscores the importance of this guideline.
That's superb, and that shows the importance really of the ESCMID study groups in their generic sense, but with yours in particular. Well done, and congratulations on that. By your own admission, though, there was only 1 or 2 treatments when you went to medical school.
Right.
Why did you choose then to get involved in this field? Did you suspect it was the easy route through life?
Oh, no, definitely not. I was originally very much interested in viral infections, of course. I'm a kid of the 80s and 90s, so HIV was very hype, and that's where I started off until I went into a different hospital, and then my boss told me, Andrew, you take care of fungal diseses, and that's how I personally
And you thought it was athlete's foot at the time, right?
Not really, but I thought really boring thing.
Yeah.
But it wasn't that boring after all. And it was a lot of fun, and I think we can encourage a lot of young doctors to look into the field of infectious diseases. Don't only focus on what everybody's doing with bacterial infections. It's important, of course, as well, but there are other infections besides bacteria, viral infections, and especially fungal infections. And what I would like to also see, our group, as we're expanding, to introduce younger physicians who might bring up a new idea, new studies that we could involve them and get done through our study group, because our network is big. We are not only a European study group, we also incorporate people from North America and even from Asia. So that actually, that's the idea of ECCMID or ESCMID anyhow. That
it's a global platform
it's
now.
It's becoming more and more global. It's not the European platform as it used to be. It's becoming more and more global. You can see it here. There are a lot of people from North America and especially Asia, not only Europeans.
And Africa as well, I guess.
And of course Africa as well, yeah.
So what do you consider as the biggest unmet need right now in your field of study, sir?
Well, what we're tackling is that the diagnostic procedures are still poor. There are very interesting study reports out there looking at autopsy data in hem-onc patients or hematological malignancies that those patients have 30% have a fungal disease, but only 25% of those diseases are recognized prior to death.
Wow.
Meaning we're missing a lot of these patients, and one way around is if we just do prophylaxis, but I think the big unmet medical need is to improve diagnostic procedures and be sure that we develop good guidance for our fellow colleagues, that we have a streamlined management of diagnostics and therapy to improve the outcome of our patients.
Sounds fantastic. Now, how big is the extent of your study group at the moment? How many people are involved?
Well, we're about 80 people.
About 80 now.
Registered people. We had our business meeting yesterday evening. There were even not over 80 people visiting, but we also had some new people in there that were not registered members as of yet. So I hope that we are expanding more. And again, I just kind of reiterate what I said before. We're looking for younger doctors, physicians, from everywhere in the world to participate in our study group, and I think we could also manage a lot more people and get more input.
So this is your call to action, really, isn't it? Get involved.
I'm calling you into action.
Nothing wrong with that. Get involved in the fungal study group
and
now.
Don't be afraid. Even if you just graduated from medical school, you're happy to join us. We're not a group of experts. We're a group of physicians trying to improve patient care.
Everybody welcome.
Yeah, everybody.
With or without athlete's foot.
With or without athlete's foot.
Not a problem at all. Well, I hope the call gets listened to and responded to. Andrew, it's been a real pleasure having you on the show here
Thank you
on
for having
ECCMID
me
TV.
here. Yeah.
Thank you, sir, and I wish you well with the rest of Congress.
Yeah, thank you very much.
A pleasure to meet you. Thank you so much.